Good morning, everybody. We've had a lot of agents that are getting into Medicare or that are about to start using our fact finder, and it's going to start actually talking to seniors about their Medicare on a daily basis. And so we want to go over the basics of Medicare, kind of Medicare 101, the ins and outs of Medicare, so that agents feel confident not only talking about the basics of Medicare, but also fact-finding about Medicare and asking specific questions that are in our secure fact finder that we're going to start using. So today I'm going to go over all the basics. I am in no way a complete Medicare expert. I know enough to help seniors with it. I don't know every single thing about it in general. This presentation I'm going to be using is from 2014, and so some of the figures will be a few dollars off, and so as far as the A and B premiums, or B premium, A and B deductibles, be sure to look those up for the exact 2016 numbers and for any future years that agents are watching this video. So we are going to start by walking through this presentation. I'm going to be giving some of my thoughts. I've got a lot of notes I want to go over because I want to go over Medicare in general. I want to go over Medicare Part A, Medicare Part B, Medicare Part C, which is Advantage plans, Medicare Part D, which is prescription drugs, and also Medigap and Medicare supplement plans. My 5-year tenure in the business has been, most of my exposure has been to Medicare supplements. Sold hundreds of Medicare supplements. Just enjoy that product a little better than the Advantage plans, but they both have a purpose, they both have a need, and so I'm going to go over all of it. And so we're going to start by saying, what is Medicare? What benefits does it cover? What benefits doesn't it cover? And so we're going to go over, what are my other coverage options? When can beneficiaries enroll? We're going to go over everything as far as the ins and outs of Medicare and Medicare in general. So what is Medicare? Medicare is the nation's largest health insurance program. It provides high-quality health care to people ages 65 and older, also for people ages under age 65 with certain disabilities, and for all people that have ESRD or end-stage renal disease. For those that don't know, Medicare was signed into law back on July 30th of 1965 and has been around ever since then. Medicare is governed and administrated by CMS, Centers for Medicare and Medicaid Services. And as we mentioned a few minutes ago, there's 4 different parts. There's A and B, which is managed by the federal government and referred to as Original Medicare. There's also C and D, offered by private health insurance companies with an approved Medicare contract, as well as Medigap and Medicare Supplement, which I feel is one of the most important parts and the simplest parts of Medicare in general. They definitely did something right when they came out with Medicare Supplements because it definitely simplifies it. And we'll go over all the ins and outs, but we'll also go over the actual sales pieces that I use when I'm demonstrating Medicare and actually selling Medicare in someone's home. So Medicare Part A stands for hospital. And the hospital insurance is managed by the government to help cover inpatient hospital care, skilled nursing facility care, hospice care, some home health care, and beneficiary, they may go to any provider that accepts Medicare. Now the Part A only covers certain amounts. Under Part A, there is a $1,184 deductible. Again, that number is a little off, it's a little older. Once that deductible is met, then obviously Medicare will pay certain portions of daily hospital stays up to so many days. Works the same way with skilled nursing facility. Now there's also, and this is just the extreme basics of it, Part B, which is medical. So Part A was hospital, and Part B is medical. And medical insurance is managed by the government to help cover covered preventative services, covered in- and outpatient doctor services, outpatient surgery, hospital and emergency room visits, lab fees, and x-rays. Even durable medical equipment such as oxygen tanks or canes. And the beneficiary, again, may go to any provider that accepts Medicare. Now, Part A, which was for hospital, was free. Well, Part B, there is a premium for that. And as obviously, as long as someone had worked for 10 years or paid in for 40 quarters, so to speak, then they are eligible for Medicare services. The Part B, the previous premium was $104.90. That's removed from a senior Social Security on a monthly basis. So say they have a $1,000 a month Social Security check, they would receive $895.10, and they would receive the remainder of that after the Medicare Part B portion was paid. Now, there is a annual deductible, just like there was with hospital. They had to meet that deductible before it would pay for hospital services. The same applies for Part B. There's a $147 annual deductible. I believe it's a little higher now. It's up in the 160s. Once that annual deductible is met, then Medicare covers 80% of all medical services for any of these medical services that were listed above. And so there's a 20% co-insurance for most services after deductible is met that the beneficiary, Medicare beneficiary, does have to pay for. Now, one thing I do want to, I don't believe, before we dive into this, I'm going to go over, as far as signing up for Medicare and turning 65 and going on Medicare, how does all that work? And the way it works is if they are already on Social Security and they're automatically enrolled by Medicare, typically 3 months before they turn 65. Well, and that is for A and B, and they didn't normally get that in the mail, and they're normally automatically enrolled. Otherwise, if they're not automatically enrolled, they don't hear anything, or they're not on Social Security, they're going to need to go to the Social Security office or contact Medicare to actually set that up, or to make sure that they are receiving Medicare when that time comes. Now, as far as we'll get into this a little later, but as far as signing up for a Medicare supplement plan, they can do that up to 6 months before they're 65. And a lot of seniors will actually sign up for that before they even get their Medicare Part A and Part B card. But most agents do not know that they can sign up ahead of time. We generally know what their Medicare ID number is going to be. Sometimes it comes back a little different with a different letter on the end or under their husband's Social Security. So we will tweak or change that once we find out that it is different. Now, there is, as we mentioned, there was a cost. Part A is at no cost, or Part B is that $104.90 a month, and which covers all of these different things that we have talked about. Generally, the easiest way to explain it, and we'll get into this sales piece that I use later on, is that it covers 80% of bills, and the insured's generally left over with the other 20%. It's kind of an easy, simple way to put it. No, it's not politically correct, but it's a very simple way of explaining it. So how does Medicaid tie into all this? Well, there is Medicaid, and if they are eligible for Medicaid or on Medicaid, then they just have Medicare and Medicaid, and they do not need a Medicare supplement plan. There's also Social Security disability, which are seniors under the age of 65, and when they're on Social Security disability, after they've had disability for 2 years, they're eligible for Medicare's Part A and Part B. Now, during that time, most individuals on Medicare under age 65, they are not aware that they need to go ahead and sign up for a Medicare supplement plan during that time because they're in their initial Part B open enrollment. So what that means is they can sign up for a Medicare supplement plan with no health questions. There's also another open enrollment when they turn 65. Now, what if someone wants to sign up for Medicare and they are working and they like their group coverage? Now, most of the time, their group coverage is not as good as the Medicare coverage that they're going to have, but if they are in group and they want to keep their group health, or their company is paying for their health insurance and they do not want to go on Medicare, well, the Part A is free, so that's going to go ahead and start. But they would want to wait on their Part B, so they have to pay for their Part B. and so that their Part B would initiate an open enrollment later on. Now, there is a group health open enrollment when they're coming off of group coverage. They have 63 days to get into a Medicare supplement with no health questions. Some companies pay us very little to almost no compensation for that, but a lot of times people are healthy enough to health qualify to be able to get a Medicare supplement. So here's all the things that Medicare does not cover. Obviously, the Part A and B deductibles, the hospital stays, the copays for hospital stays, the copays for skilled nursing facility, the co-insurance, the emergency medical coverage outside of the U.S., annual hearing exams, eyes, prescription drugs, and out-of-pocket medical costs. So now we're going to the next sections we're going to go over the three options they have, which is Part C, which is Medicare Advantage plans, prescription drugs, and Medigap with Medicare supplement plans. We'll spend most of our time on Medicare supplement plans because generally this is a kind of an introductory to Medicare, Medicare 101, and the individuals that will generally benefit most from this are new agents that are just getting into Medicare, and you generally do not start out selling Medicare Advantage or Part C as a new young agent. I didn't sell it at all for the first 3 years of my career, and I'm actually glad I didn't because I learned the ins and outs of supplements and really learned to love supplements, and they can be great for the right individuals. Okay, so Part C, Medicare Advantage. These are offered by private health insurance companies with an approved Medicare contract. Now, beneficiaries must have Part A and B to enroll, and they continue to pay their Part B premium, even though this is an alternative to Medicare and does replace their original Medicare. They still have to keep the A and B to be eligible for this, because what most people don't know is that Part B premium that they were paying to Medicare is now going to this Part C or Medicare Advantage carrier. That's how they're able to offer coverage for limited coverage for a premium of $0. We're not allowed to say it's free, but we can say it's at no cost. So, the Part C, it may require using certain providers. A lot of times there are specific networks, and we'll get into that in a little bit, but a lot of times there are specific networks that you have to adhere to, certain doctors, certain hospitals, those kind of things. When you combine Part A and Part B and add in some benefits and features that are not covered by Part A and B, which may include Part A and B deductibles, hearing exams, an annual limit on medical costs, prescription drug coverage, eyewear, and worldwide emergency medical coverage. So that's where you get into A and B and Part C, which we need to know what Part C is, the positives and negatives of it if we're going to help seniors or advise seniors on what their best option is going to be. There's two different types. There's HMOs and there's PPOs. HMOs must use doctors, hospitals, and plan networks to receive benefits. Some plans do require referrals, and some offer added benefits to those with government assistance. PPOs provide all the benefits of an HMO while offering a little more flexibility. They have the flexibility to use doctors and hospitals outside of their plan network, often at a higher copay or higher coinsurance. Beneficiaries generally must pay, obviously, the rates or the monthly premium of the Part B, but sometimes there's a Part C plan premium as well that they may have to pay, as well as the copays when they pick up their drugs, or the co-insurance on their drugs, or the donut hole coverage gaps or catastrophic gaps that come with prescription drugs or Part D. And so beneficiaries will not have to pay, when they have a Medicare Advantage plan, they will not have to pay the Part A deductible. They will not have to pay the specific hospital copays in relation to Part A Medicare. They won't have to pay the Part B. They won't have to pay the 20% coinsurance. They won't have to pay anything for certain other procedures, and they will not have to pay an additional monthly premium for the Part D drug coverage, because they won't have to pay these specific things because the Part C or Medicare Advantage plan has certain cost for certain things, and each plan is different. Typically, there's a copay to the doctor, Generally, there's so much to go see a specialist. Maybe it's $10 for a doctor copay. Maybe it's $50 for a specialist. Maybe it's $300 a day in a hospital for a stay of 6 days. A lot of times there's a max out of pocket of anywhere from $3,000 to $8,000 a year. And so the coverage, we will not have to pay these because the coverage is different in Medicare Part C or Medicare Advantage. Now this brings us to Part B, prescription drug coverage, which unfortunately I feel like is the most confusing part of Medicare. And a lot of seniors feel like it's the most important part of their Medicare, and they just a lot of times don't understand it. And so they need our help to simplify the way this works. At the end, I'm gonna go over how I simplify things. Part D is also offered by private health insurance companies with an approved Medicare contract. Approved Medicare contract means they are approved through Medicare to offer these plans. They are purchased in addition to A and B, and they help cover prescription drug costs, generally through standalone drug plans or through Medicare Advantage Part C plans. So as you can see, they've got the A and B, and they've got the prescription drug, and we'll get into the additional medical coverage. Now, there are 4 different steps that must be reached within the same calendar year before catastrophic becomes active. Now, obviously, you have a deductible, you have the initial coverage periods where you have your copays, you have the coverage gap where you've got to pay larger coinsurance for generics or brand names. And then you get into where you're actually cost sharing with the insurance company, where you have to meet. Obviously, there are certain amounts you have to where you start in a donut hole. You have to pay so much before you can actually leave a donut hole, and it varies by individual and varies by drugs. A lot of times, someone will, they'll have the donut hole around the end of the year. And it really just depends on how expensive their drugs are. And explaining that portion of drugs can be challenging if we don't know how to properly simplify it. Now, they do have to pay for the Part B and some type of, obviously they have original Medicare and then the RX or prescription drug coverage. This gets us into the least confusing area and the most simple area, which is Medigap or Medicare Supplement plans. These are health insurance policies sold by private insurance companies. They do exactly what they say. They fill in the gaps of Medicare, and they supplement Part A and B services and supplies to cover medical benefits such as Part A and B deductibles and coinsurance. There's 11 standardized Medicare supplement plans. We will go into each and every one of those. Well, I won't go into every one of them. I shouldn't say that. I'll actually go into the ones that I think that are valuable, that people actually need, and there's only a couple of them that I've ever even sold. And these do not include prescription drug coverage. Just because, like original Medicare, they're not allowed to cover drugs. So there's a monthly premium for Part B. You've also got the Medigap plan premium and a Part D premium. So, and we'll go into that. And if you think about it, most individuals are paying upwards of $500, $600, $700, $800 a month, $1,000, $2,000, as much as $3,000 or $4,000 a month for their actual group health or individual health insurance coverage before they go on Medicare. Well, Part A is free. Part B, in this example, $105 a month. And then a Medicare supplement plan generally can run from $100 to $150, $160, $170, depending on the state, depending on the plan, depending on the male or female, all those things. Generally, you can get a Medicare, you can have A and B and a supplement and drug coverage for about $250 to $300 a month. And if you think of having full 100% coverage where there's no copays, no deductibles, no out-of-pocket expenses, and no network, which means you have 100% coverage anywhere in the nation, doesn't matter if you stub your toe or if you have a major transplant, you're 100% covered anywhere across the nation that accepts Medicare, which is, if you think about it, is really strong and is really valuable in the amount of money that they're actually paying for the value that they're receiving. And so I'm a big fan of of Medicare supplements just because of the simplicity of it. And so this is all the different plans. I'm going to touch on F and G, the two most popular plans. Now, F is being removed from Medicare in the year 2020, but F and G are the two most popular plans and are the most sold plans. I would say that G is probably the most popular, most sold plan at this moment, but F was shortly ago. So, an F plan, as you can see, checks all the boxes, covers the Part A deductible, covers any hospital copays, covers any pints of blood, covers any Part B coinsurance, covers any hospital copayments or coinsurance, covers any skilled nursing facility, covers the Part A deductible, covers the Part B deductible, covers any Part B excess charges, and covers any foreign travel emergencies up to certain limits. And so if you think about it, it's full 100% coverage for Medicare-approved procedures that are performed at someone that accepts Medicare, which is rare that someone doesn't accept Medicare. So it's a very simple plan, covers everything. Well, now there's also Plan G, Medicare Supplement Plans, and the G is exactly like the F, except for it does not cover the Part B deductible. That is the only difference between the F and the G. And typically, if you take the Medicare Supplement premium and you take it times 12 and you take the Plan G premium times 12, you generally save an average of $300 a year by having a G over an F. Well, if the only difference is paying about $150, well, you've generally saved about $150 to $200 a year by going with the G. Yes, the F is slightly simpler. You don't have to worry about paying for anything or paying for deductible at all. But generally, the Plan G is actually more cost-effective and is still very, very, very simple. And that is the only difference between an F and a G. So now we've went over all the Medicare coverage options. There's A and B, there's Part C, there's prescription drug, and there's Medigap. And there's different costs that go with all of those. And I am a big fan of, obviously, Medicare supplements. Now, there is a annual election period, AEP, for Part C and Part D. Individuals can shop their Advantage plans or the prescription drug plans between October 15th and December 7th of every year, and those new plans actually start on January 1st. Those apply to, most people think that they can shop their Medicare supplement during that time. It does not apply to supplements. It only applies to C and D. And so now I'm going to kind of talk about the average cost of Medicare A and B, and I was doing some research last night preparing for this, and the average annual health care cost. These are numbers from, I couldn't find any current numbers. These are numbers from 2004, so they are much lower than the actual figures would be today. But seniors between the age of 65 and 74 would an average of about $10,000 in, or their care costs about $10,000 a year on average. The 75 to 84-year-olds is about $15,000, and 85 plus it's about $23,000 on average. The average amongst all these, generally, because there's more seniors at the younger ages, there's about a $13,000 per year average of health care cost for individuals 65 and older. Again, these are numbers from 2004, so the numbers are much higher now. Now, the Medicare supplement plans, they have been sold since 1966. Ever since Medicare came out in 65, they came out with supplement plans or Medigap plans back in 1966. Well, these supplement plans or these Medigap plans have to follow federal and state guidelines, which are designed to protect, the insured. And so we're going to go over some of the things that go along with that we find in the Medicare New Guidebook that actually pertain to Medicare supplements. So here's one. This is a Medicare plan comparison chart. This is something I put together to when I was doing some mailing and some door knockings. It actually compares all of the different plans that are available. It also has a couple of excerpts that I like a lot that are in the Medicare and You handbook. One of them says that every Medigap policy must follow federal and state laws designed to protect you, and it must be clearly identified as Medicare supplement insurance. It's nice to know they have to follow federal and state laws designed to protect our seniors. Also, different insurance, and this is right out of the Medicare and You guidebook. Different insurance companies may charge different premiums for the same exact policy. As you shop for a policy, be sure you're comparing the same policy. For example, compare Plan A from one company with Plan A from another company. So a plan, just for example, a Plan F with AARP, or a Plan F with Cigna, or a Plan F with Mutual Omaha, or a Plan F with Transamerica, or a Plan F with IAC, Plan F with Manhattan Life. A Plan F with any carrier has the exact same coverage and the exact same benefits as any other Plan F. They cannot go buy a Plan F and it be different than one that we can sell them with any of the companies that offer them. The nice thing about that is if every plan's the same, there's only a couple differences when you're purchasing a Medicare supplement plan. The differences are the company and the agent, and the biggest difference between a supplement from one carrier to the other, or one Plan F to the other from different companies, is the price. That's the biggest and only difference between the actual coverage you receive, is that some companies charge less than others. And so that's why being an independent insurance agent and being able to shop amongst 30, 40, 50, 60, 70, Medicare supplement carriers is a nice thing to be able to offer, because you're able, not only able to shop so you can offer the best price up front when they are turning 65, but we can also shop on an annual basis for our clients to make sure that they are in the best Medicare supplement plan for them. Now, shopping on an annual basis brings up something that is available in Missouri. It's only available in a couple states across the nation. I know it's not available in like Arkansas, Texas, Oklahoma, Kansas, and that is that in Missouri we have an annual open enrollment around a Medicare supplement beneficiary's effective date. So say they turn 65 July 1st of 2015. Well, their Medicare started July 1st of 2015 most likely, and so did their supplement. And so July 1st of 2016, that was the 1-year anniversary of their policy. Well, there's a 60-day window, 30 days before and 30 days after, where a Medicare supplement beneficiary in the state of Missouri can shop their plan. They have to be moving from like plan to like plan. So they have to move from a Plan F Medicare supplement with Transamerica to a Plan F Medicare supplement with IAC, and not be able. And actually, IAC does not pertain to that because we have to help qualify with them. But the Medicare beneficiary can go from one Plan F to another Plan F with a different company. They're in their open enrollment, so there's no health questions. It's counted as an external replacement. It's a guaranteed issue, so again, there's no health questions. They cannot be turned down, and they are able to get the same coverage, same benefits, but actually just pay a lower premium than what they were paying before. Which there are some positives and negatives to that being available here in the state of Missouri. There's also, as we talked about before, coming off of group, where they have that 63-day window to purchase a supplement without health questions while they're in that guaranteed issue. And there's also a Plan G, which they did away with the Plan G back in 2010. Plan J. Please, I apologize. Make sure I don't confuse you. Plan J. Medicare stopped selling Plan J back in 2010, and a Plan J, the F is the new J, so to speak. The J covered everything. Well, there's also a Plan J open enrollment around their effective date where they can move from a J to an F with no health questions. It'd be guaranteed issue, and they would be able to pay a much lower premium because a lot of the insurance companies are actually pricing seniors off of the J because the Plan J is no longer available. They no longer sell it. They don't have new, young, healthy insureds going into that block of business. Therefore, that block of business is growing older. Their health is getting worse, and they're having to charge more premiums to the individuals in those Plan J blocks of business to compensate for the higher cost of that block, if that makes sense. Other thing I would like to go over is the sales piece that I use when I am going to see someone that is turning 65 or just someone that doesn't understand Medicare. And this is something I've made that is I call it Medicare Made Simple. And the way I use it is, Mr. Joe, Miss Betty, the first day of the month that you turn 65, you are automatically enrolled into Medicare Part A and Medicare Part B, which comes out of your Social Security check. And I believe that figure's right now where it's $121.80 a month. That will pay for your Part A and your Part B. And all this isn't politically correct. I'm just I'm simplifying it for the Medicare beneficiary. Part A is hospital, and Part B is medical. Now, with your hospital, you do have a Part A deductible each year that you have to pay out of pocket. Once you meet that Part A deductible, and you've paid that out of pocket, then Medicare will cover 80% of all your hospital and medical bills. Same thing for Part B. You have a Part B medical or doctor deductible. You have to meet, once you meet that doctor deductible and you've paid for that doctor deductible out of pocket, then Medicare picks up the other 80% of the remaining medical bills. So Part A and B, and again, this isn't politically correct, but it simplifies it and individuals understand how it works. Part A and Medicare Part A and B covers 80% of all hospital and medical bills after the two annual deductibles are met. And you say, well, what do most individuals do to cover the Part A deductible, to cover the Part B deductible, and to cover the other 20% that Medicare does not cover? What most individuals do is they purchase a Medicare supplement. It covers the other 20%, so it eliminates the 20% coinsurance, plus it picks up whatever Medicare doesn't pay, and it pays for both deductibles. What we are doing is we are eliminating the Part A deductible. That's gone. You don't have to pay that because you have a Medicare supplement. Also, we are eliminating the Part B deductible, and you do not have to pay for that any longer as well. Plus, it picks up the other 20%. So what that does is, in essence, they have a 100% comprehensive plan with no copays, no deductibles, no out-of-pocket expenses, and no network. They can go to anywhere in the nation that accepts Medicare. If they want to go to the Mayo Clinic to have a procedure done, by all means, there's no network. So again, it doesn't matter if they stub their toe or if they have a major heart transplant, they are 100% covered anywhere in the nation that accepts Medicare. The only downfalls to original Medicare and a Medicare supplement is that it does not cover vision, dental, or drugs. Most individuals do not cover vision or dental at all, and they just purchased a separate standalone prescription drug plan for $15, $20, $30 a month to help cover the cost of their drugs. Even if they're on all generics, I've had some people that say, I've had some seniors that were turning 65 and they were on no drugs at all. Well, they still need to purchase a Part D prescription drug plan, even if they're on no prescription drugs at all, because there is a 1% per month penalty up to 36 months for waiting and not purchasing a Part D drug plan when they originally go on Medicare. And so again, that is a penalty that is 1% per month. Say they waited 12 months after their Medicare to get a Part D, they would have to pay a 12% penalty for the rest of their life on their Part D plan. So hopefully this has explained how Medicare works. the ins and outs of Medicare. Hopefully I've showed you a way to simplify Medicare when you're in the home of an insured. If you have questions or would like this, please let me know. I'll also go over the Advantage piece real quick as well. This is the alternative to Medicare, Medicare Advantage, aka Part C. I'll use this for individuals if I think I could sell a Advantage plan at the appointment. I'll pull this out as well. Premium is typically $0 to $50 a month, and there's copays. $5 for a doctor, $40 for a specialist, and these are averages. $200 to $300 a day in a hospital, a max out-of-pocket of $3,000 to $7,000 a year, and they have a specific network that they have to use, and they can only go to certain doctors and hospitals. It also covers vision, dental, and it also has limited coverage for vision, dental, drugs, and home health care. Obviously, the negatives is they cannot budget it. They could meet their max out-of-pocket of $5,000 a year if they had a rough year. That could very easily happen. And that they can't budget it. It's a little riskier. There's a little more of a gamble to it. But a lot of people are in perfect health or they can't afford it, and those are the individuals that generally tend to take a stronger look at this type of plan. Let me look over my notes, make sure I've covered everything that I was planning on covering. For the agents that are on the call, I know we've got a few on the call this morning. I know we're going to have several others that will be watching on YouTube later. For those that are on the call, are there any questions that jump out at you that you'd like to ask before we wrap this up? Again, you can look this up on the Secure Agent Mentor YouTube channel. It'll also be available on secureagentmentor.com very shortly. I appreciate everyone for joining. Thank you guys for listening. Again, this was just a Medicare overview, just a Medicare 101, just going over the Medicare basics. I didn't want to go into too much depth or expand on any one topic too much in general, just because it can get very confusing and very complex. I just want you to have the basics so that you feel confident talking to Medicare beneficiaries or seniors about their Medicare, and also confidently filling out and asking the questions about that go along with our fact finder. So again, thanks for joining. This was just a training call about the simplicity of Medicare and Medicare basics. So again, as always, Cody Askins with Secure Agent Mentor and secureagentmentor.com. If you have any questions, please feel free to contact me. You can reach me at cody.askins@secureig.com. Again, thanks for listening, and talk to you soon. Bye-bye.